These doctors say Halifax ERs are in critical condition, and new plans to tackle that emergency don't address their biggest problem.
We sometimes spend whole shifts seeing patients only on ambulance stretchers or on chairs or benches in hallways.
Dr. Lori Beatty says there aren't enough available beds, and that's the main driver of long wait times.
We really are having to look outside the box to give anyone in the waiting room or on the ambulances the emergency care that they need.
She's one of dozens of Halifax emergency doctors who signed a letter addressed to the Premier, demanding more spaces for patients, ultimately speeding up access to care. Dr. Neil Petrie signed it too.
I think there's probably more tragedy to come unless we make some changes.
Last month, 2 Nova Scotia women died after spending hours in emergency departments, 67-year-old Charlene Snow and 37-year-old Alison Holtoff.
These are tragic, tragic cases that are at least partially attributable to emergency department wait times.
There is no one single fix.
The Premier knows it's a problem. In response to the letter, he says other changes the province is bringing in will make a difference.
As we make some change, then somebody will say, what about this? And that'll probably happen until the end of time. And that's okay, because we'll keep addressing the what about this.
After last month's deaths and an emergency meeting, Nova Scotia hired patient advocates to watch over people in emergency rooms. It will expand virtual care and give more authority to pharmacists in an effort to keep non-emergencies out of ERs.
I feel like I would much rather have them working on solutions that are going to get to the heart of the problem and fix this more long term.
The province has previously promised more beds for the Halifax area, but it'll be years before those are ready. The doctors say speeding up that timeline should also be a focus if the government wants to see real change. Kate McKenna, CBC News, Halifax.